said, I'm Lauren Strachan, Commodity Manager for the Corporate Services team here at Greater Glasgow and Clyde. I've been in the role for about 2 months now, having previously managed the medical surgical team. Claire's also on the line, as Francis said, and Claire will be the procurement lead for this process, which will be processed hopefully in the next week or two, all going well. So thank you all for joining us today for this Meet the Buyer opportunity. I'll give you a bit of a background to some of the specialist support service for the people affected by multiple sclerosis tender process, which, as I said, will be published shortly. NHS Greater Glasgow and Clyde has a population of 1.2 million people, and it provides services for people with neurological conditions, including multiple sclerosis, from the Institute of Neurological Sciences, which is the INS. The Institute is a world recognised specialist centre for neurologically, easy for you to say, neurosurgery, spinal injuries and neurorehabilitation medicine. The services provided are predominantly to populations of NHS Ayrshire and Arran, NHS Greater Glasgow and Clyde, NHS Highlands, Argyll and Bute, and the Health and Social Care Partnerships there as well, and also NHS Lanarkshire. The Institute provides a range of regional and national services to wider populations of up to 5.3 million people. There's over 11,000 people in Scotland who are living with MS, and many of those are not purely clinical needs in nature. So NHS Greater Glasgow and Clyde has therefore funded various specialist support services for people affected by MS for several years. We wish to commission a robust set of services to provide support and care to people with MS and their families and carers, which aligns to the aims and strategies of both NHS Scotland and NHS Greater Glasgow and Clyde in particular. Okay, some of the tender requirements we have, as I said, we're commissioning the support for MS. The support service is expected to provide a person-centred, flexible, eco-sensitive model of care which provides support through many years with people that live with the condition. Key roles of the service will include a focus on self-management for people with MS, which helps to support them in the hospital, out with the hospital environment. Assisting individuals to navigate the health and social care team, including signposting to relevant existing NHS, HSCPs and other third-party services. Also assisting individuals in navigating the benefit system, providing emotional support to people with MS and their families and carers, with the provision of information and advice, including support literature to people with MS and their families or carers, building peer support networks and other non-medicalised interventions for supporting people and their families or carers. All services that we're looking for also need to be delivered in accordance with NHS Scotland strategies, which are, some of them I've got bullet pointed here. The National Healthcare Quality Strategy, the National Health and Social Care Delivery Plan, Realistic Medicine, and NHS GGC Moving Forward Together strategy. It will also be the responsibility of a successful bidder to manage the MS support services flexibly across the city to ensure that there's consistent support offered. And it's expected that patients will self-refer or self-present to these services, but referrals can also be expected and should be accepted from health, social care and other third-party organisations. Under these circumstances, it's expected that the full consent of the individual has been gained for onward referral, and NHS Greater Glasgow and Clyde is not prescriptive in what these services should be, and it's for the bidders to provide an outline of the range of services to be delivered to meet the aims mentioned above. The level of detail required for each service will be outlined in this tender specification and tender documentations, any supporting documentation that will be published. The notice, the tender contract notice will be published in Public Contracts Scotland portal, which is PCS portal, Francis mentioned, and the tender will be published in the PCS tender, PCST portal, with all the relevant documentation and supporting documentation required. The scoring methodology that will also be outlined on the invitation to tender, but the scoring methodology we use is 0, which is unacceptable. That gives you that, so that's nil or inadequate response, fails to demonstrate an ability to meet the requirement. Then we have 1. If you score a 1, that's a poor response, with the response is partially relevant or poor. Not address some of the elements and requirements, but contains some insufficient and limited detail or explanation to demonstrate how the requirement is fulfilled. And then we've got 2, which is an acceptable response, where you've maybe provided relevant and acceptable, but it's lacking a broad understanding of the requirement and details. Then we've got a 3 for a good response. Again, it was a relevant and good response, sufficiently detailed to demonstrate how good understanding and provide details on how the requirements will be fulfilled. And then a 4 is excellent, so completely relevant and excellent overall. So again, this will be outlined in the invitation to tender document, which will be available on the Public Contracts Scotland tender portal, hopefully in the next week or 2. And that's really everything. That's everything I had to cover.